I want to start off talking about disparities because, of course, this has been top of mind for a lot of people as we've um, thought about racism and racial disparities over the last couple of weeks. And as I was looking up some of these stats, they kind of they actually blew my mind to some of the disparities here. If you look at even college educated Black women, they're actually 1.6 times more likely to die from pregnancy than a white woman without a high school diploma, as you know. And I'm wondering if you can just start off by giving us some thoughts about why that might be. What are the leading causes here?
So, Black women in the United States are between 3 and 4 times more likely to die of a pregnancy related cause than white women in our country. In my state of Illinois, Black women are 6 times more likely to die. And that's after you control for factors like education level, income level, whether or not the woman had prenatal care or her insurance status, where she lives geographically. You can control for any number of factors, and that disparity persists. What we do know is that there is nothing inherently wrong with the woman. And so it's our country, it's our society, it's the way that Black women are treated within our healthcare system. And we know that Black women often can walk into a clinic or a hospital, express that something's wrong or doesn't feel right, and not be treated the same way because of implicit and explicit bias. There have been many researchers who are studying the disparities, whether it's related to blood pressure causes or infection or mental health. There's individual, explicit causes of death, but the key is that in this maternal mortality space, this disparity has persisted, and it's been this way for my entire lifetime. I'm 33 years old, and we've not seen, large national initiatives to try to solve this problem, and that's why we started the Black Maternal Health Caucus.
Well, and to your point about Black women feeling like their concerns aren't taken seriously enough, I know we've heard stories from prominent people. Serena Williams' story is coming to mind where they were expressing concerns to her provider and they felt like they weren't listened or weren't heard. Do you have thoughts about kind of how we can improve that relationship and interaction between the patient and the doctor in those settings?
Absolutely. So there's many different things we can do. We have to change the culture of our healthcare system. And a one-time webinar or training is not going to do it, right? This is something where we have to embed in our providers that we need to listen and center that patient's experience. Um, Train our providers to recognize their own implicit and explicit biases, right? Implicit is, I didn't know that I was treating one patient differently from another. Explicit is racism, right? Let's just make it plain. And then, we need to make sure that we have providers that reflect the diversity of the communities that they serve. We need to make sure that every woman truly has a choice in the kind of provider that she can see, whether it's a gynecologist, an obstetrician, whether it's a midwife, a nurse midwife, or a certified midwife, whether that woman wants a doula to assist with her birth and delivery or not, like that kind of stuff is really important. And it all goes into that woman's experience in our healthcare system. I would say we need to make sure that we are recruiting, training, and ensuring that every community across our country has a diverse set of providers. We need to make sure that these providers are trained to recognize their own biases, and that there are accountability measures in place for health systems that, don't always course correct after there are these kinds of disparities that are seen to persist within their system.